support, or and why we are unable to, అంటే మనం ఎందుకు వాళ్ళకి అన్నిట్లో చేర్చుకోలేకపోతున్నాం, ఎందుకు వేర్ వీఆర్ లాగింగ్ బిహైండ్, వాట్ ఆర్ ద రీజన్స్ అనే దానికి మూల సూత్రం వచ్చేసి దేర్ ఆర్ లైక్ మల్టిపుల్ రీజన్స్ యాక్చువల్లీ. One is like orthopedic disabilities or some locomotor disabilities, and other would be sensory, and other would be speech and hearing, and another would be vision. సో ఇందులో ఏంటంటే చాలా మందికి కాంబినేషన్ ఆఫ్ డిజీజ్ నాట్ డిజీజెస్ ఆఫ్ డిజబిలిటీస్ ఉంటుంది, ఆర్ ఇన్ఎబిలిటీస్ టు పర్ఫార్మ్ ద డైలీ యాక్టివిటీస్ ఉంటుంది, ఎస్పెషల్లీ ద కిడ్స్. సో వీ కెన్ ఆల్ వీ కెన్ డూ ఇస్, ఇప్పుడు మనం డిస్కస్ చేసుకోబోయే టాపిక్స్ వీ కెన్ కోరిలేట్ విత్ అవర్ ఎగ్జామ్స్ అండ్ హౌ వీ కెన్ కోప్ అప్ విత్ ఇట్. ఫర్ ఎగ్జాంపుల్, దిస్ టాపిక్ స్పెసిఫికలీ ఆర్థోపెడిక్ డిసేబిలిటీస్ మనం ఇవాళ డిస్కస్ చేస్తున్నాం, బికాజ్ ఇట్స్ అ వాస్ట్ టాపిక్. నాట్ ఓన్లీ ఆర్థోపెడిక్, ఎనీ డిసేబిలిటీస్ ఇస్ ఎ వాస్ట్ టాపిక్ అని. సో we have to come to now the definition. Any inability to perform a basic movement which a normal human being can perform. Uh, see, like ఇప్పుడు మనం నార్మల్ రెగ్యులర్ వెళ్ళే స్కూల్ పిల్లలు వాళ్ళంతా మంచిగా సైకిల్ కానీ బస్ కానీ బైక్ ఎక్కేస్తారు, ఆర్ దే కెన్ బోర్డ్ ఎనీ transport, they can walk on their legs, they can go to school, they can listen everything what teacher says, they can perceive, అంటే టీచర్ ఏం చెప్తుందో అర్థం చేసుకోగలుగుతారు వాళ్ళు. మళ్ళీ దే కెన్ రెసిప్రోకేట్, టీచర్ ఏం చెప్తుందో వాళ్ళు ఎందుకు ఏం క్వశ్చన్ అడుగుతుందో లే లాజికల్ థింకింగ్ కానీ వాళ్ళు అగైన్ రెసిప్రోకేట్ చేయగలుగుతారు. సో నాట్ ఓన్లీ దట్, దే కెన్ రైట్, they can read, they can sing, they can cry, they can uh, they respond to the social behavior. That's all. Why? Because they have everything normal, like normal brain, normal cognition function, motor function, sensory function. So which students lack that normal anatomy or physiology of the brain, or spinal cord, or sensory coordination movements, or any characteristics like autistic characters. So they cannot reciprocate. ఫర్ ఎగ్జాంపుల్, ఆటిజం పిల్లలు ఏముంటుందంటే వాళ్ళు ఎప్పుడు వాళ్ళ ప్రపంచంలోనే ఉంటారు. దే కాంట్ సీ ఐ టు ఐ, దే కాంట్, ఇఫ్ యూ ఆస్క్ దెమ్ టు, మోస్ట్ ఆఫ్ దెమ్ కెనాట్ రెసిప్రోకేట్, దే కాంట్ అప్రిషియేట్ మీకు ఏం చెప్తున్నారు. ఇప్పుడు పేరెంట్ కానీ స్టూడెంట్స్ కానీ దే విల్ ఆల్వేస్ బీ ఇన్ దేర్ వరల్డ్. ఫర్ దెమ్ లైక్ ఏబిసిడి కానివ్వండి ఏం అవసరం లేదు వాళ్ళకి. ఓన్లీ తెలుసు అంటే ద వన్ హూ ఫీడ్స్ దెమ్, ద వన్ హూ టేక్స్ కేర్ ఆఫ్ దెమ్, వాళ్ళని గుర్తుపడతారు అంతే. వాళ్ళని కూడా పెద్ద అప్రిషియేషన్ ఉండదు వాళ్ళకి చూసి, సోషల్ స్మైల్ కానీ అలా పెద్దగా ఏమి ఉండదు, కానీ జస్ట్ దే రిమెంబర్ దెమ్, దట్స్ ఇట్. అది ఎందుకో ఇప్పటికి ఎవరు తెలియదు. There are lots of research in this going on, but still there's a lot to go. So in this orthopedic disabilities, we can see why they are unable to go to the regular school, and why they are not included in the regular schools, and what are the social barriers which are causing them that social barriers. ఇప్పుడు ఆ సోషల్ బ్యారియర్స్ అయినప్పుడు ఎందుకు వస్తుంది ఆ బ్యారియర్ అంటే, ఒక నార్మల్ చిల్డ్రన్కి ఒక వికలాంగ చిల్డ్రన్కి ఎందుకు అంత మన వ్యత్యాసం ఎందుకు ఉంటుంది, మనం ఎందుకు తలుచుకొని కూడా వాళ్ళని ఇంక్లూడ్ ఎందుకు చేయలేకపోతున్నాం. ఫర్ ఎగ్జాంపుల్, మనం ఒక బస్ బోర్డ్ చేయాలా, అబ్బాయి ఎందుకు, అబ్బాయి కానీ అమ్మాయి కానీ ఎందుకు ఎక్కట్లేకపోతున్నాం బస్, బికాజ్ దే ఆర్ నాట్ ఫ్రెండ్లీ టు ద differently able to person. So we can, definition we can see easily like inability to perform a normal task or basic movements where it can be done by a normal human being. So because of which person cannot enjoy the normal activities like social schooling, playing with children, uh, eating their own tiffin box, they are like singing, dancing, painting, or a simple task like catching the spoon. So they lack in almost all the fields where they are not socially accepted by others, because other students like to play, they like to have their own kind of people. So that's a definition for orthopedic disability. So we can see the examples like walking, running, cycling, games, even include చేసుకోవచ్చండి ఇందులో. So suppose a teacher says, okay, tomorrow we have class, or tomorrow there is a holiday. They can't even appreciate that, okay, tomorrow is a holiday. Why? So that's lack, they lack the social thinking, or if suppose if they are able to understand also, they if they are unable to reciprocate, we will think they are differently able. That's it. So you have different kinds of anatomical problems, like for example, which are causing uh, what do you say, orthopedic problems, which are unable, because of which uh, people, the kids are unable to walk or locomotion or transport themselves to schools or sit in a school properly, or they are unable to use the washrooms. So those are all social barriers. Because why there are occurring for the social barriers? Because they have any one of this kind of problem, or they may have, along with orthopedic problems, they may have the sensory problems or the balance issue, or uh, the coordination problem, or vision problem. So, coming to congenital anomalies, the word congenital itself says like it's anything, any person born with anomaly. Anomaly is irregular structure or dysfunction. So, uh, it occurs when occurs in the womb. కడుపులో పుట్టినప్పటి నుంచి వచ్చిన దాన్ని కంజనైటల్ అంటారు, పుట్టుకతో వచ్చిన దాన్ని. సో ఇన్సిడెన్స్ రేషియో 6% of the world population. Causes can be many, but they mostly there are congenital, genetic and consanguinity, like mannericum lo చేసుకోవడం, environmental factors and nutritional factors. There could be again many dangerous issues like contamination or radiation from the industries, or any which anything which causes harm to the mother womb can be a contributing factor. Suppose a mother has is consuming every day what is a polluted milk or food or water, that may also add to the problem. So it's not definite like, okay, ఈ పొల్యూటెడ్ వాటర్ తాగితే ఓన్లీ ఆర్థోపెడిక్ ప్రాబ్లమ్ వస్తుంది, ఈ పొల్యూటెడ్ వాటర్ తాగితే ఓన్లీ న్యూరో ప్రాబ్లమ్ వస్తుంది. ఇట్ కుడ్ బి ఎనీథింగ్, హౌ మదర్ womb may get damaged or affected. So what are the consequences? ఒకసారి ఇన్ఫెక్షన్ ఆర్ anomaly స్టార్ట్ అయిపోతుంది, ఇట్స్ అ పర్మనెంట్, ఫస్ట్ థింగ్ ఇట్స్ అ పర్మనెంట్ డిజబిలిటీ. ఇట్ కెనాట్ బి మళ్ళా మనం తిరిగి వాళ్ళని మంచి చేయడానికి ఉండదు. సో ఎస్టిమేటెడ్ ఈస్ లైక్ 2,95,000 newborn babies die reaching 4 weeks if they have a congenital anomaly. Like head may be very small, the chest may be or the complete infant, the infant may be completely very small baby, like with very less weight, unable to, or irregular development of lungs or body parts. So they may die in a complicated situation where before delivery or during delivery. So what it causes? It causes deformities of the limbs or the palate or the skull. It may, there may be any contributing factors. So you have oral facial clefts. The oral facial clefts are like the mouth may be open in below the nose, or the lower lip, and the other factors are like other defects are like neural tube defects and limb deficiencies. One limb may be short, one limb may be length, one limb may be absent, or the fingers may be deformed, like claw, or some deformity, any deformity, or what do you say? It may be deviated from your midline, so your leg is going somewhere and you are standing somewhere. So they may have many problems like balance, gait pattern, gait problems. So which will contribute to, again to the your what is a social cause, like why they are unable to include it in the uh, inclusive education, or unable to help themselves in social life. So treatment curable is only like minimal orthopedic disabilities or minimal surgeries uh, which can be cured. Others which are more deformed cannot be managed. So after like suppose they have, for example, if we take scoliosis, a bent spine, S shapes of the spine or forward bending spine, or some mild weakness of the limbs, they can be corrected by physiotherapy, occupation therapy, and supportive device. Supportive device care is like they can use braces, they can use uh, calipers, they can use some uh, supportive device where weaker muscles may get support. So polio, next condition is like polio, which is almost all eradicated, but it's still good to have idea of it. You may get in exam sometime they may ask how a polio kid may uh, why the polio kid may not get included in uh, why they may not get a chance in inclusive education. So you can tell that if you have an idea based on that. So first thing, polio is caused by the virus. So polio virus. So and it is also permanent disability. Once the polio virus is enters the human body, it stays and incubates. And once the virus enters and through the oral route, through contamination, generally the feces where it is uh, in contaminated the soil. Mostly the virus spreads in that soil and the child once he touches it and without washing hand, if he eats or if he, the virus enters through the oral route. So once the oral route it enters into the gut, and once it enters into the gut, it started its own multiplication, and once it spreads, the incubation period completes, and the virus is totally effective. So it they basically affects the spinal cord. So once the spinal cord, like brain is the controller, and spinal cord is the cord which maintains your all the movements, all the control of your body. For example, a nerve from your hand or the leg goes into the spinal cord. From spinal cord, it goes into the brain, and again from brain, it comes to the spinal cord. From spinal cord to your that part of the limb. So what that means is it's like the plus and minus wire in your rooms or the in your home, like the circuit. You can say like the circuit. Your brain is your controller or the control room, and your muscle which is contracting has to get signal from your brain or suppose the reflexes. Suppose, for example, if you touch a candle, hot candle, with that flame, we will remove the hand immediately. Why that is happening? Because the once uh, the pain stimulation is received through the brain through afferent through one wire, and the brain perceives it and says to remove it automatically. So obviously that signal again comes back to your hand from the brain. So that's how the system works. So once this spinal cord is affected, this all contraction and relaxation of the muscle will get affected. So in polio, you can see mostly from below the waist or below the lumbar area, you will have no contraction and relaxation. So you can see the legs of the polio patient and the hip mostly like paralyzed. So they may be semi-paralyzed or mostly paralyzed. So they will have a very weaker muscle or very thin muscle or just a bone with just a sample of muscle. So why it is happening? Because The virus has affected the spinal cord where that entry and exit of the signals has to occur is been damaged. So the brain will not get signals or contraction orders or relaxation orders from your hand. So obviously it will go into wasting of the muscle. So initial symptoms, once the virus is affected, the child will have fever, wasting of muscles, headaches, slow growth, muscle weakness. So treatment is only like we can't do anything once the virus is fully spread. So apart from the anti-inflammatory drugs and the rest, we can't do much. Physiotherapy also is limited here, but we can, for example, we can make sure the child gets prosthetic limbs, like prosthetic supports like calipers, and we can work on balance. Physiotherapists will work on the balance, gait training, and remaining muscles which are left. We try to strengthen like calipers, what is it, crutch muscles, especially how to handle the crutch, how to mobilize themselves, how to sit, how to get up. So physiotherapist role will be very crucial in this. Preventive condition of this is only polio vaccine. Almost worldwide, all the top countries have sorry, have eradicated the polio, including India. Maybe we have one or two cases that too unreported or mostly can be uh, almost the I think WHO has declared us uh, polio-free country. So next it comes to the next condition is like bone TB. Here we are going on discussing one by one condition in a very brief manner, not so deep, so that you have an idea. Suppose they have a question, uh, what does a tuberculosis, how does a tuberculosis affect your um, uh, daily life? Like, so we should have an idea. Okay, bone TB. Is there is some topic called bone TB? Okay, TB comes generally. People think it comes only to the lungs. So once it comes to, if you know that you can get a bone TB also, you no need to smoke or no need to be drunkard to get a TB. A general public also can get a TB irrespective. Smoking in smokers, you may get the chances of higher to get this one TB, bone TB. But mostly you can see in a common ratio public also. So the TB is caused by again tuberculosis bacillus, which is a bacteria that is Mycobacterium tuberculosis. So commonly seen as after TB lungs or some of them I have seen many of them without any primary lung TB, but they still have got the disease. Don't know why. So mostly it affects the spine, followed by long bones or short bones. Majorly it affects spine. And again, we come to spine. We have seen an example before, like how if a spine is affected, the bone, suppose the bone is affected by the bacteria, the bone gets softened there, and it all gets pus formation. You can see the word granular matters inflammation. Any outside of our body, any virus, anything enters inside our body will fight back. It will cause an inflammation. And again, inflammation is a condition where it's an automatic or auto-responsive way of dealing with the foreign particles. Like suppose we get a fever, or suppose we get a injury, there you will see the redness. We'll say it's an inflammation, swelling. So why it happens is our body rushes there lots of blood, and so that the healing happens fast. The WBC reaches there more, everything. So here, if you see, uh, the granule it becomes once bacteria attacks the spine, then automatically there will be inflammation there. There will be a fight between the bacteria and our antibody, our own body antibody. So once the bacteria is progressive, so there's not much we can do because the chronic granulomatous tissue formation will be there. So it will cause uh, uh, more of pus, and the bone becomes very soft and fragile, and it may break. So once it causes damage to your spine, the obviously spinal cord will get compressed. So once the spinal cord is compressed, the below level where it is compressed is all uh, what do you say, is compromised. The same, like they will have problem with walking, weakness, sensation, motor coordination, because all the nerves which supplies from the spinal cord below that level will get affected. Suppose L1 level is at the lumbar spine, level 1 and 2, between level 1 and 2, for example, the tuberculosis is occurred. So what will happen below L2, L1 and L2, that is from L2, you will see signs and symptoms where the nerve, wherever it is supplying till our toe, gets affected. You may not feel sensation, or you may feel burning sensation, numbness. You may feel weakness. You may see lack of movement. So it is again based on uh, severity of the condition. So there are two types of responses in that. Proliferative is something like inflammation with lots of fibrosis, and it may spread. Exudative is non-reactive, silent, it will not spread much. It's a local response. In proliferative, it may spread to other parts of the like long bones, short bones, one after the other. But in exudative, you'll have not much. Suppose there is a TB, there, okay, then once it get detected, there's a silent, what do you say, we can, it will be a local response. So what happens to the bone? Inflammation results in local trabecular necrosis. Necrosis means any loss of blood supply and cell death. Any cell death is called necrosis. That will happen because cells which are present in that bone or any part of the body where the lack of blood supply is happening, or the very less blood supply is happening, the cells keep on dying due to lack of oxygen. So that is necrosis. And cessation, that means stopping of your blood to to that part of the bone. So next, what happens is demineralization of the bone, because you'll not have proper nerve supply, contraction, and poor absorption of blood from your bone. So the bone get demineralized step by step every day. So cortex of the bone gets eroded. They are the layers we have. Cortex are your strong structure pillars inside your bones. Like you have a small porous kind of thing, which will get more porous and get eroded. Eroded means it will get fall, removed step by step. So pus will collect at the periosteal layer. Periosteal means the bone which has a superficial layer, the top layer, is called periosteal layer, and that there you will have a pus collection because the bacteria will cause pus, and obviously many joints may be involved. So if we come here to the treatment, conservative treatment means the basic starting treatment is anti-tubercular therapy, like we give all the TB treatment for 7 months, 8 months based on the doctor's suggestions. So surgical treatment is again, sorry, it will mostly will be like these are the what do you say, surgical terminology like transectomy. Ectomy means removal of your that part of the bone or the body part. So you can see coastal part of the transverse part. anterior lateral part. So you can, based on the structure which is involved, the doctor will choose either to remove only the coastal surface of the spine, or to remove just the lamina or the front part of the lamina, or the side branches or the branches of the spine. So, or just to decompress. Sorry. So, based on the doctor's call, it would be based on the anatomical. The doctor will take the call, and he will remove that part of the spine, and he will replace it with metal or some other graft of the spine. So, like other body bone part or something. So, after that, we have to go for the pain management and treatment for paraplegia. You can see the word paraplegia. Para means two parts which is below the like below your lumbar. You have both the legs almost paralyzed or weakness. So obviously, once you have the weakness and the paralysis, so physiotherapist will have to work on that. He has to strengthen all the uh, body below the legs, like the legs part, and he has to work on the gait. He has to again take care of the post-surgery deformities or complications, like bed sores from not only bed sores, the weakness in the limbs, the due to lack of physical movement, even the lung capacity goes down. So we work on the lung capacity as well. And then the next condition is congenital talipes equinovarus. That is called CTEV, which you can commonly see in regularly in kids. Like they have the foot deformed, 1 in 1,000 live births. So you have different types of CTEV. That is equinus, calcaneus, varus, valgus, cavus, planus. You have different types. These are all like if you see the first condition, equinus is walking on toes, like normal regular kids also do, but in specifically in CP and specifically in autistic children or with sensory disability children, they have this equinus problem. And calcaneus is again dorsiflexion of the foot. They will walk on the heel of the foot. Before condition they were walking on the toe. It's reverse now. They will walk on the heel of the foot. That is the back side of your foot. So varus is again foot inverted in sense like the foot is facing towards the midline of your body. Valgus is foot everted. Your foot is facing outside the midline of your body. And cavus is again longitudinal arch is uh, exaggerated in sense like it's spread widely. So planus is like a flat foot you can see in many conditions. So why etiology is like why it happens is no proper reason for that. So um, what you have because of that you have bone deformities, sizes and different shapes. And different deformities will cause again, as we discussed, problem in your locomotor, problem in your sensory motor cognition. Suppose if you need to catch up, suppose you need to wear your shoes, or you need to stand up, or anything, gait pattern, everything will get affected due to this. So what happens here? Muscles and tendons are underdeveloped. Why they are underdeveloped? Because there is no regular usage of the muscles. If you see a regular kid, if he is walking and running, the muscle and the tendon will react according to his or her body requirements, and they will grow as fast as the kid is active. I mean to say, like, suppose the kid is very active, like in running, playing cricket, playing all the time at home. home doing all activities. So they will have a very good mental and physical growth as well. Like muscles, tendons, everything. You have a good blood supply till their toe, from head till toe. But a kid who is sitting idle, not because he's wantedly sitting, or maybe due to involuntary, he will not have definitely a good muscle strength or muscle reaction or reflexes. So obviously the body will not ask much from the kid for the muscle growth and the tendon. So they will have a poor development, underdeveloped muscle and tendon. So as well as the capsule and ligaments also not uh, not nicely developed. So diagnosis can be easily noticed or detected after the birth X-ray. So through X-ray, treatment is again conservative. Conservative treatment means like without using any surgical procedure, uh, with the basic things how we can manage and improve the patient. This one. So you have manipulation alone. Manipulation is again, for example, as I discussed, suppose there is a spine problem. We will keep on correcting every 3 months the kid. Suppose the foot is inverted, we will alter in the shoe, creating an arch to the opposite side. That work would be a prosthetic person's work, where on suggestion of from the doctor, they will create shape of different shoe, or they will give an arch in the shoes. For example, flat foot, where the the foot curvature is lost. So that curvature is given by the artificial means, by an artificial arch in the shoe or sandal. Like similarly, suppose the foot is inverted, they will try to correct it with a different opposite side with a correction in the shoes or in the sandal. So that work is again assessed by the prosthetic and they are done. So again, Kite's philosophy is again you can say like for every few months if you keep on uh, correcting the posture or the foot correction, the deformity can be what do you say stopped or minimized to the greater extent. And some with a greater deformity needs a surgical treatment. So mostly the uh, tissue release in sense like suppose they have a shorter tendon or the shorter muscles, they will have a surgical cut and again the tendon is lengthened uh, and again sutured. So they may do it for every 4 years or 6 years based on the surgical call or tendon transfer from a normal tendon to transferred and again sutured. Or bone correction surgeries are again mild bone chipping of the bone and bringing it mostly near, almost near to the anatomical position. Suppose the foot is deformed away from your body, and due to the extra growth here in the joint, the surgeon will remove that extra growth, chipping off the extra growth, and he will correct it. So you have again the management of correction is CTV splints. Okay, the CTEV splints are given from starting once a child is diagnosed with this. They are brought to the prosthetic and orthopedics person. So for every few months, like 4 to 6 months, the CTEV splints are either changed or altered based on the person's growth. So, and they will have different kind of shoes or modified shoes according to their child's requirement. So once they are given, the child may have a better, not more much of deformity. The child will may have very good walking help due to surgery or due to regular braces of the this one given by the orthotics. So next comes condition is the deformities of the spine. So deformities of the spine is anything which is deviated from the normal anatomical position. So these are like, if you see, we are standing in a straight line, our spine is in the straight line. But you can see some people like polio persons or some CP childs or some uh, persons with physical deformities, they have bending of the spine or side bending of the spine or very flat spine. You can see. Uh, those are all conditions which are deformed, but it doesn't mean that every condition is serious. Only in major conditions where the lumbar spine or the spine is very severely bent and it is causing compression to your spinal cord. Those conditions are dangerous to the kid, and during growth it may cause obstruction and it may cause heavy deformity in adulthood. So for them again we will have a surgical corrections and braces all those things. So you can observe with your naked eye, like the child is bending and walking, or is side bending, side posing and walking. We will scold them, walk properly. But once we open their shirt, we see the spine, it's not in the straight line. So they can refer to the orthopedic. Orthopedic again, they will refer to the physio or for the braces for the orthotics and prosthetics. So physiotherapy treatment will be majorly concentrated on the deformity and the angle of spine, how much angle is the spine is deformed. Suppose the spine is deformed from cervical till lumbar. We'll draw a straight line from the starting point of the first deviation point and ending of the that deviation point, like from lumbar. So the points where it intersects, there is a angle. We will calculate based on the Q angle, not Q angle. It's a Cobb's angle, I think. So okay. So that angle we'll calculate and we'll see how much deformity is there. Based on that, we'll plan the treatment, surgery, or the braces which is required for the kid. And we keep on assessing every time, like for every 6 months. Okay, how much is the spinal correction? What is the angle reduced? How much is the angle reduced? How much it is helping? So we keep on assessing and improving. So next is injuries of spine. Injuries of spine is a general term. Is mostly road traffic accidents or fall from the tree or height. So mostly it causes sorry, upper spine fractures or the lower. So based on the fracture area, you can see and the number of areas fractured. You will have the spine getting fractured and crushing your spine or puncturing your spine or damaging your spine. So based on the damage of your spine and the spinal cord, you are directly the condition is directly proportional here. For example, suppose 50-60% of your spine is damaged at the lumbar area, you will have maximum damage like uh, lack of movement, lack of sensory, lack of. So the directly proportional is the ratio of the damage of the spinal cord is directly proportional to the ratio of damage. In sense, like you will have the clinical features based on how much damage is occurred. So that would be direct impact fractures, like direct damage caused due to single blow or cut or fall. So if you see the types of problems, you can see quadplegia. You can see here plegia and paresis. Plegia means like the weakness. Sorry, the plegia is paralysis. That means, and paresis means weakness. The word quadriplegia means quadri means four. All your four limbs will get affected if C5, C6 level, I mean to say, in the cervical level, if you get a damage from C2, C3 to C4, C5, C6, anywhere in that part, below that part from the neck will have damage. So that may cause permanent paralysis and lack of movement in all the limbs, that is both the hands and both the legs, and your respiration may also get compromised, and will not have any sensory uh, issue, not have any sensory powers like to control your urine or motion. That would be reflexes will be almost zero. So suppose when the subject is passing the urine or the feces, he or she may not know because due to lack of coordination from the spinal cord to the brain and back to the urinary bladder. So you can see again paraplegia is again two limbs like lower limbs, and monoplegia is again single limb. So treatment is always emergency phase because subject once he comes from the road traffic accident or any fall from the tree, then again X-ray and all those things are taken. Based on that, the treatment is planned, like surgical is needed or conservative treatment is needed. So physiotherapy management would come under again positioning of the patient proper. Suppose there is a spine which is already fractured and it is what is it displaced outside, which is piercing the spinal cord. Again, we will not like that to be happen more spinal cord to be damaged. So the patient is avoided in a wrong posture. So they will try to be, based on the orthopedic surgeon's requirement, the physiotherapist will try to do the treatment without causing again damage uh, to the subject. So next condition is called spina bifida. This is again a spinal deformity which is caused due to improper closure of your arches. If you see spinal cord, it will have a nice spine. If you see spine, you will have a nice canal going through in the nice canal like opening. In that, spinal cord will be descended down from the brain. So if that spine is not properly closed, and then the spinal cord with spinal nerves will get exposure to outside of the body. So that will cause the condition called spina bifida. So you can see as in definition like failure of fusion of arches around the neural canal causes spina bifida. You have different types of conditions in this. Spina bifida occulta. Occulta is again like you just need to know the terminology, you don't need to go much deep, but if you know the conditions, again, suppose you may get a questions. So spina bifida occulta again, it's a failure of vertebral arches. Results in vertebral arches is again the side arches of the spine. So that spine, the solid structure, the body of the spine, will have an opening from the sides where the arches are not fused. So in bifidus, bi means two. The two spines, the two sides of the spine will not get fused. So common in S1. So this is not so severe condition actually. The spina bifida. You see a small dimple and mostly no neurological impairments. Neurological impairments means the spinal cord is not coming out of your spine. Just there is an improper closure. So you will see a small dimple. Dimple is a small cave, like small. You can see the compression. So mostly neurological problems, impairments because the spinal cord is still intact, still inside, and the spinal nerves are still inside and as per anatomical position. So you will not see much of a problem there. But in spina bifida aperta, involves not only vertebral axis but also overlying soft tissue, skin, and another meninges. So common site is dorsal lumbar spine. So you can see you have again types in this. That is meningocele, meningomyelocele, and syringomyelocele and myelocele. So if you see the meningomyelocele, protrusion of meninges means the spinal nerves which are coming out with all the spinal stuff uh, is called meninges. That what you say, the liquid along with the liquid in the which hangs in the spinal cord. So actually, our spinal cord will be descended in the spinal liquid. So once there is opening, that meninges also will come. The liquid also will come out. So the spinal cord mostly won't be hanging there. So it will be descend. It will be like always in a traction. Now we can't feel your spinal cord. A regular person may not feel your spinal cord because you will not feel it is always suspended in a liquid called our spinal fluid. That is meninges. So if you see any infection in that fluid also, doctor will take what you say the needle aspiration and they will send it for uh, lab diagnosis. That is another different condition, but I'm just saying here. So meningomyelocele again you'll see the protrusion of meninges along with this is another condition meningomyelocele protrusion of meninges along with some neural elements. Before this condition, there are no neural elements involved, so there is no much of damage. Always the neural elements plays a crucial role in your determination of what the condition is. Syringomyelocele, the central canal of the cord is dilated. That is, your spinal cord is dilated. But in myelocele, results in arrest in the development at the spinal cord, the opening. So after that, the spinal cord along with all the spinal nerves are protruded outside. So it will cause a bulb-like protrusion. So that will cause much of damage because below that level of it mostly occurs in lumbar. Below that level, again the spinal nerves where the supply is there is compromised. That means you will have loss of urine control, loss of reflexes, of filling of bladder, wasting of your lower limbs, uh, poor contraction of your muscles, poor contraction of your flexors, extensors, like you can't walk against step, you can't walk on a normal balance problem, gait problem. All this occurs in due to this condition, myelocele. So treatment is surgical closure in that condition. Most of the conditions don't require surgical condition except surgical profile except the neural canals with the except the neural stuffs which are outside the spinal cord. So after that, the physiotherapy role comes in. So the prevention of further deformity, like strengthening of the weaker limbs, again gait and balance training, and again prosthetics and orthotics comes in with the role of physiotherapy attached in it. Like physiotherapist may ask to give the splints required based on the deformity. Suppose anyone requires for flexor, like knee KFO, for example, you can see KFO. KFO is like knee, ankle, foot orthosis. Orthosis, uh, let me tell you about orthosis is a supportive device. Prosthetics is again a false limb which can be replaced with an artificial limb. So that is the definition of it. And splints. Splints are again supportive devices. Okay, so next is infection of bones and joints. So this definition again you can see like microorganisms causing osteomyelitis. You have two types of conditions in this. This is a common in boys, acute osteomyelitis and chronic osteomyelitis. So you have what are the causing agents? Staphylococcus aureus and strepto and pneumococcus. So just need to know about this, not much deep. What would be the complaints from the child? Once any bacteria or this infection occurs in the bones and joints, you can see obviously that part will have features uh, clinical symptoms like pain, swelling, inability to move the limb, weakness in that movement, weakness in the joint, or redness in that area because there's inflammation started there, and because of it, obviously fever will start. So the test would be blood test and X-rays will sometimes MRI or CT may require. So treatment if the child is brought in 48 hours of the onset of symptoms with systemic antibody, the basic NSAIDs, non-steroidal anti-inflammatory drugs, they will be cured properly and they can recover in a more better stage. But after 48 hours, if the pus is formed, if the damage is more, they have to remove it surgically, followed by physiotherapy. So next is comes is amputation. Amputation is a condition where we remove the part of the limb to protect other rest of the part of the limb or the body. Uh, so mostly you can see in road traffic accidents or in diabetic conditions where you will see the gangrene condition where you will see necrosis and formation of pus in diabetic conditions. We remove the most of the part to save the rest of the part. Okay. So disarticulation is removal of the from the joint. Okay. So indications are again injury, diabetic gangrene, infections, tumor, or nerve injuries, where rush injuries. You can say specifically once the nerve or the muscle cannot be repaired or damaged. So those are uh, removed. We have few names like guillotine or open surgery and closed amputation surgery. So names of the amputation levels are based on uh, the surgical anatomical surgical part which has to be removed. For example, if you see four-quarter amputation, four means you have scapula, one, lateral two-thirds of clavicle, whole limb. So you can see from the scapula, lateral two-third, your complete clavicle and upper whole limb involves your shoulder joint, elbow joint, so the rest of the whole limb. And shoulder disarticulation is removal only from the shoulder. Your shoulder is removed. What do you say? Your upper arm is removed from your shoulder joint. That is called disarticulation. And above elbow is elbow disarticulation, below elbow amputation, and ray amputation, removal of fingers. That is called ray amputation. Lower limb also has the specific names based on the positions, like hind quarter, whole limb with ilium. That is your hip joint and whole limb. That is one side of the leg. So next you can see the ebony amputation and knee disarticulation. Ebony amputation is cutting like 1 knee, 1.5 inch above your knee based on the anatomical requirement, or below knee disarticulation and below knee amputation. Symes amputation, that is ankle joint removal. Chopard's amputation, that is half of your ankle is removed, that is talonavicular joint is removed. And Linsford amputation is intertarsal joints removed. That is mostly in diabetic patients based on the starting level of the damage, the parts are being removed. So treatment is avoiding secondary complication. Again, they don't want the infection or damage to be spread to the other parts of the body. So what will happen after the surgery? Those will be replaced by prosthetic parts. Prosthetics means artificial limb. Orthotics means supportive limbs, supportive devices, not limb. Because the limb will be there itself, you will only provide a supportive device. In prosthetic, the limb is removed or cut from your body. So you need a supportive device. So if you see here, AFO, ankle foot orthosis, from based on the anatomical position, the names are given. So KFO is knee ankle foot orthosis. Hip and HKFO is hip ankle knee foot orthosis. So like that you can see along with that knee orthosis, cervical orthosis, wrist and hand. There are so many things based on the patient's requirement. So after surgery, the physiotherapy role comes in, focuses on stump management. Stump is the rest of the limb which is left out. The point where you have to apply the prosthetic limb is stump. So there you will see of maintenance with along with the everyday bandage or the thread bandage, and maintaining the shape of the stump is very important for repairing a prosthetic limb. So gait training, balance and weight training. So crutch strength training all is a part and parcel of it. So next comes is cerebral palsy. Cerebral palsy is a is a non-progressive motor disorder actually. So one second. Yeah. So if you see a cerebral palsy, it's a heterogeneous group of non-progressive motor disorders. Non-progressive in sense, once the damage is done in the say brain, it is not progressive. It is a permanent damage and it remains the same whole life. So caused by brain injuries that originate in perinatal period. Okay. So perinatal period is again in womb. The damage may occur due to lack of oxygen, due to direct impact of any blow, which causes damage to the brain, or you can see the mother gets lot of fits, or uh, during surgery, during the delivery, there may be problem in the delivery problem. So the child may get stuck and may get lack of oxygen, and sometimes the loop of the mother from the womb may get encircled around the neck and may cause uh, hanging like situation. So the child may not receive oxygen. Any condition which causes lack of oxygen to the brain may cause damage to the brain and permanent cell death. So what happens in cerebral palsy? You see spasticity. Spasticity is tightness of the muscle. Echetoid is abnormal involuntary movements, and ataxic is balance and cognition problem. The CP child may always have this major problems. And mixed cerebral palsy is again you may have splint eyes or deformed fingers or deformed long limbs like our legs and hands, or for bent spine or the curvature of the spine may be abnormal. Along with that, you may have involved movement like he'll keep on shaking his hand, leg, or he'll keep on beating himself. So if you see the next slide, you can see the parts of the brain. Here, if you read properly, different colors of the brain, what do you say, points out at different uh, functions of the brain. If you see the red side of the brain, they are responsible for problem solving, emotional traits, reasoning, speaking, and voluntary activities. Voluntary motor activities. That means, suppose you want to draw something, you want to sing, you want to solve any problems, you want to say like something, express. Suppose you want to write a poem or anything, then it's all you can make it up here. I mean to say here it goes on. So in temporal lobe, you can see the blue one, understanding language, behavior, memory, hearing. If you correlate this diagram with your complete subject, which you're going to write exam, you can understand, okay, because of lacking in this so and so part of the brain, that child is unable to do or unable to perform. For example, you can say take example here. In blue color, you can see a memory problem or the hearing problem. Hearing problem, if you take and along with the coordination, along with the occipital lobe with the posterior backside, you can see the green one, vision and color perception problem. This is a common problem seen in CP and other neurological issues like autism. So they are unable to appreciate it. So you can see which part of the brain is involved in this. So, yeah, so for example, the child is unable to balance himself, or he's going on beating himself, he's going on attacking or trying to uncontrolled movements. Suppose he's unable to hold the pen also. So that means you can see the posterior side, the violet color, the cerebellum part. You can see the parts responsible for this are the function responsible are balance, coordination, and motor control of voluntary movements, and fine muscle control like painting, piano, or any brushing your teeth or any grooming yourself. Any fine movements of your muscle control is responsible is cerebellum. So we can see the parietal is lobe is again the yellow one. He is responsible for sensation, reading, and body orientation. So these all, if you can correlate yourself, okay, what is the barrier now? So you can take an example from this diagram and say, what is the barrier now? Why the child is unable to understand your emotions of the teacher, emotions of the rest of the kids or his friends? Why is unable to play? Why is unable to uh, you know uh, hold a ball? Or at least do any action which a normal kid can do. So now you can reason yourself, okay, this is the issue somewhere lying here in the brain. So if you see the condition types, spastic, that means increasing the muscle tightness, because of which as I said, it is one of the barrier where the kid is unable to walk or stand up due to much of severe contraction or mild to major contraction, which is causing the child not unable to move the movement of the limb freely. So it may be upper limb or lower limb or both. So that will cause the movements, very less movements, and sticking to the bed or to a wheelchair. So next is athetoid or dyskinetic CP. You can see the involuntary movements. Dyskinetic characters are inability to maintain finger, toes, tongue, and other body parts in stable position, resulting in continuous slow sinusoidal movements. They'll keep on beating themselves or no, 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 no. They keep on saying some nagging or some other words. So this contributing factor would be basal ganglia damage. We have seen the basal ganglia here in the cerebellum. We have seen this. Okay, so you can see the brainstem here. So basal ganglia comes here actually. Here in the this is a another view. We need to have another view of the brain so that you can see the basal ganglia. So another kind of condition is like ataxic CP. Ataxic is inability to perform smooth coordination movements. So voluntary movements and unsteady movements. So here you can see which is responsible for your fine movements. You can see in cerebellum, the posterior side, the violet color, fine muscle motor control, coordination and control of fine movements or voluntary movements. So which is damaged here? You can correlate yourself. You can see the balance problem, which is responsible for balance, cerebellum, right? If some there is issue with eating or swallowing, you can see the brainstem. So in mixed type of CP, there are many all others. It would be like jumbled. Anything may happen to that child. So what will happen to the child if he gets a CP? He may lose his milestones. He may not reach his milestones in a given time. These are all examples like milestones. How we calculate for 3 months, like neck control, respond to sound, family familiar to mom and everyone. No, familiar to mom and dad, mostly to the near and dear. 6 months, he start to support with sitting and tries to hold hands or crawl or lift his head up, make some single sounds or grunting sounds, or some sounds which make sense. So, like after 6 months to like 12 months, he starts to walk with support, then without support, then holding the father or mother, and starts to balance himself and tries to speak some words. After 1 year to 1.5 years, like he's playful. He'll always will be like running, jumping, uh, and till 2 years he's almost in schooling. I mean to say after 3 years he's into schooling. He can make sense. He can socialize himself. He can do the reasoning stuff. So that would be lagging in a normal kid. These are all milestones. If you check here, milestones will be missing. The child may always sleeping until 1 year or 2 years. The child may not get speech, or child may have poor vision or poor listening skills due to the problem somewhere lying in the brain. So why are milestones so important for self-realization and assessment parents? That means the parents can see like child is unable to, help himself, or he is unable to reciprocate what the parents are asking. Like, uh, Ismail, anything they won't, they may not be in a condition to reciprocate. So the parents can self-assessment, do the self-assessment, and they bring as early as possible to the doctor. So early recognition and prevention and early intervention therapy. Early intervention therapy is like suppose you have a, problem with your speech or hearing, so the those experts may come in, and if you have problem with your orthopedic like motor disability or any issues, the motor, you need to say the orthopedic and the neurological team may come in. So based on the requirement, you can help the child. So team includes doctors, physiotherapists, occupational therapists, prosthetics, and nursing care. Again, CP is a very vast topic to be discussed. It takes a lot of stuff, because there are so many areas to be discussed actually. So, for example, cleft palate may also come in. The splint, the uh, problem maybe with the fingers, movement, deformity in the limbs. Any condition may add to the contribution. So, physiotherapy CP is again prevention of further damage. Early intervention, rehabilitation, spasticity is the tightness management. We do lot of stretching, proper positioning of the patients, and we'll try to rehabilitate patient with the kid with uh, everyday daily balance activities and playful activities. Mostly gait is compromised here. Gait means the way we walk is a normal gait. I mean to say uh, the left and the right motor coordination of the um, limbs are, I think they call gait balance training. So we do that for these people. We strengthen the weakened muscle. We reduce the tightness. We avoid fatigue. Fatigue is again a condition of the muscle where you may not see much of appreciation of contraction or relaxation. So physiotherapy role is early intervention. Like we don't want the condition to be more uh, compromised or derailed. So we like to that kid to join in normal regular classes. Suppose he has a problem with only holding the pen or leg hand movements or inability to stand up by himself. We will like to calculate, we'll do the assessment and see how much he can be rehabilitated so that he can walk with braces or with slings or with the calipers, what all required. We'll try to strengthen the basic muscles, and we try to teach him how to use crutches or how to mobilize himself, how to avoid injuries, how to do home exercise at home. So uh, again, if there is a surgery, then post-surgical management will be done. Okay. So these are all pictures where you can see uh, the subject here. Complete one side of the hip is removed. This is only for showing to your purpose. Actually, we are not supposed to show the patient face here, but that's fine. We are not going to share it. So you can see the first pic. You can see here. We are giving the CP child the caliper. Caliper is a supportive device. You can see the left, the first one with the what is a metal support with the shoe in that is caliper. But in the prosthetic limb, you will see uh, here is the first one is this one here. You can see the one foot is short, so they have prepared an artificial foot with the size compared to the other limb, which is short. They have added that much of length, and they have prepared a prosthetic limb. Here you can see the calipers which are there based on like hip. You can see from the hip, knee, ankle, foot orthosis. Sorry, orthosis here, and you can see knee foot orthosis from the knee and above knee foot orthosis with the shoe support. Okay, so based on that, you have supportive device names and the braces. Again, physiotherapy is always it's a multi like we have so many things to do along with concentration or with the condition. We like to rehabilitate them and join in the schools or walk into the schools and continue with the regular activities. So occupation therapy is another very good stream of our team. I mean to say, it's another way of treating the, especially the autistic and CP child, where they have their own way of treating. So these are all camps and things. Okay, thank you. My presentation is done. Let me know what I can help you. Any questions? Any like, hello? Yeah, I have done my presentation. Like any doubts or questions, you can post. Hello, hello, hello. Am I audible? Anyone? Hello, hello. Am I audible?
Yes, sir, you are audible, sir.
Hello, hello.
Yes, sir, you are audible.
Yeah, it's audible, right? So I have done with the presentation. Was it uh, audible to everyone?
Yes, yes.
Yeah, okay. I'm done with the presentation. Any questions or queries? Please let me know.